Dear Mr. President, Vice Presidents, Honorary and Past Presidents, Officers, distinguished guests, fellows, colleagues and friends. My name is Catherine Duggan. I am the Chief Executive Officer of the FIP. It is my honour and joy to welcome you all to participate in the first FIP virtual event 2020. This year has been a year of challenge, innovation, flexibility and adaptability for our profession, for our populations and for our families. Given we face so many challenges with travel and face-to-face meetings, we have had to adapt and offer an opportunity for us all to join together today through our digital platform. We will recognise some of the work you have all done and that we have sought to support, as well as many colleagues that are due recognition during our ceremony today. Before I pass to our President, Mr. Dominique Jourdan, I would like to make some thanks. Firstly, I'd like to thank our Vice Presidents from the Bureau and the members of the ExCo, our chairs and presidents and officers from across the organisation, our volunteers and colleagues from across the profession on the front line who continue to strive for our families and friends and for pharmacists on a daily basis. And I'd like to make a thank you to my FIP team who have continued to work so hard through this year to ensure our mission and vision continue to be delivered, that we showcase and amplify the work of our profession, that we ensure pharmacy supports our patients and our public everywhere as we step up and above and beyond. And with the help of some additional team members during 2020, we have sought to ensure we are as accessible, as visible, as supportive and as engaged as you need us to be during these times. Thank you so much, team. I am very proud to be the FIP CEO, never more than at this time. So, thank you to everyone. Now I will hand over to President Dominique Jourdan, who will guide us through the next stage of the opening ceremony of the FIP Virtual 2020 event. Dominique, the stage is yours.
Dear colleagues, this year I find myself addressing you from my home country of Switzerland, as together we tackle the challenges presented to us by the COVID-19 pandemic, and we endeavour to support our communities and health systems during this global health crisis. Never have the demand on pharmacy been so great and so urgent. At this time of uncertainty and emergency, our profession has demonstrated its expertise, strength, courage and dedication to care to the highest level. Pharmaceutical scientists are involved in finding a vaccine for COVID-19, repurposing existing therapies and identifying effective treatments. Academics have worked to ensure the education of our students continues despite lockdowns, so that we may have a workforce that is ready to meet the evolving needs of our population. Hospital pharmacists have faced huge intakes of patients, with many of them moving beyond their specialties to provide critical care. Community pharmacists have performed triage and testing, supported government's pandemic initiatives, and ensured patients have continued access to their medicines in spite of risk of infection. Colleagues from all sectors have compounded disinfectants where there are shortages. Pharmacy students have been volunteering to reduce workforce shortages. These are only a few examples of our profession's valuable contributions. I would like to thank all of you around the world for your efforts. Never have I been so proud to be a pharmacist as in the past 7 months, and I am proud to be your president. FIP has developed global guidelines on COVID-19 and issued recommendations to governments in order to enable colleagues around the world to continue to provide pharmaceutical care. We have fully incorporated COVID-19 into our work to support the profession, and FIP CEO will be updating you on our activities shortly. As part of the 2-week program that we have ahead of us, we will be reflecting on living and learning through COVID-19. This pandemic has heightened many areas that FIP has been working on, including falsified medicines, misinformation and patient safety, immunization, medicine shortages, and investment in science. With many medicines producers in lockdown, increases in counterfeits have been reported. FIP has been speaking out against counterfeit medicines for over 20 years, and we are involved in several international initiatives against them. Most recently, we led a joint project with the WHO on the delivery of a curriculum on substandard or falsified medical products that will be incorporated into pharmaceutical university teaching in the African region. Fake medicines are a serious threat to life, and I urge you all to ensure the safety of patients through active participation in the fight against these products. In addition to facing a pandemic, we are also facing excessive information about COVID-19, some of which may be unreliable, negatively affect our behaviors, and worsen our situation. FIP has always advocated pharmacists as a very accessible and trustworthy source of expertise on medicines and health. Our knowledge ensures the safety of patients, not only protecting them from ill-advised actions related to COVID-19, but protecting them from harm from misuse of medicines in general. The FIP Council has just adopted a new statement of policy on patient safety, making clear our commitment to ensuring that medication safety remains high on the World Health Agenda. Related to the topic of misinformation is vaccines hesitancy. Disease prevention is imperative to achieving universal health coverage, development and prosperity. This is why FIP has been pushing the immunization agenda forward in collaboration with partners such as Immunization for All Ages and the International Longevity Center. People are now, unfortunately, understanding the profound meaning of a vaccine-free world. It is imperative for countries to expand their infrastructure and diversify their pathways for vaccination, and for pharmacies to commit to playing a central role in vaccination strategies. In addition to many other activities, FIP has organized a series of online events called Increasing Vaccination Coverage Through Pharmacists, some of which will take place during this FIP virtual program. The problem of medicines shortages, another long-standing FIP priority area, has also become more acute during this pandemic. There is evidence that shortages are worsening, creating ever more difficulties for healthcare professionals and compromising patient safety. Shortages have been reported in countries of all income levels, across all healthcare settings, and involve essential life-saving medicines, very commonly used medicines, and both high and low-price medicines. This is a complex global problem requiring global action. This weekend, the 151 member organizations of FIP committed to promoting the use of an international definition of medicines shortages described in a new FIP statement of policy on medicine shortages and a set of harmonized criteria to identify and monitor shortages at national, regional, and international level. This statement contains recommendations to ensure the future of medicine supplies worldwide. Last but not least, science. People are now seeing the importance of pharmaceutical science and the hope it carries. What this crisis has shown is that investing in science is a prudent decision. We need new medicines that are effective, affordable, and accessible, as well as new vaccines. Research also helps us to be prepared for pandemics. A year ago, researchers proposing work on a vaccine for coronaviruses, post-SARS and MERS, were finding it difficult to get funding. If we had had a vaccine already available, things would have been very different. FIP's renewed commitment to working with the WHO through a Memorandum of Understanding signed last year includes further raising awareness and encouraging pharmaceutical scientific organizations, institutions, and scientists to facilitate support for universal health coverage and greater affordability of and access to medicines. We are doing this through our Boards of Pharmaceutical Sciences, which has just celebrated its 50th anniversary, and I offer my congratulations to the board, the special interest groups, and FIP members who continue to promote the science and international scientific interchange that is so vital for progress. Our loved ones and our communities are counting on us to develop therapeutic approaches to prevent and treat diseases such as COVID-19. We have learned many lessons in the past few months, but this pandemic has also confirmed what we have always known. The role of pharmacists is crucial. Never has the value of our profession and its services been so apparent and recognized. And I was pleased to see a number of heads of state and health ministers publicly thanking pharmacists for their services. This pandemic has made visible all the benefits for communities of having competent pharmacists and a dense network of pharmacies covering the countries. But we must think ahead. We must complement this positive recognition with evidence. Sadly, at this point, over 750,000 people with COVID-19 have died. I do not want to dismiss the dramatic impact of this pandemic, but let me put things into perspective. It is estimated 420,000 people died of asthma in 2016. Seasonal influenza is associated with up to 500,000 deaths each year, and 770,000 people died of HIV in 2018. The burden of diseases that existed before COVID-19 remain, and some are likely to worsen because of the socio-economic problems brought about by this pandemic. Antimicrobial resistance has not gone away. Problems in health systems have not evaporated, and new pandemics are possible. Pharmacists will be needed more than ever to prevent ill health and ensure patient safety, but we must ensure that our profession is sustainable. The viability of our profession is an issue for the broader health sector and society as a whole. The FIP Council has just adopted a statement of policy on sustainability, which recommends that pharmacists provide data to build the evidence base for the value of current and emerging pharmacist-led professional services. FIP has already begun to collect evidence through surveys to capture the pharmaceutical response to and impact of COVID-19. This will be used for discussion with governments after the crisis to enhance pharmacy practice supported by the new policy statement. I urge you to contribute to these surveys. Dr. Tedros, Director General of WHO, has said, if there is anything positive to come from this pandemic, it must be a safer and more resilient world. Perhaps the greatest lesson to be learned from COVID-19 is that international cooperation is crucial to finding effective and sustainable solutions, not only to the consequences of this pandemic, but also to the many other health problems we face. We recognize the importance of sharing experience and knowledge, and we understand the power of solidarity. These values are all embodied in FIP. I am confident that as one FIP and one pharmacy, we will emerge from this pandemic bigger and better. Long live pharmacy, long live FIP.
Welcome FIP colleagues and friends. I'm pleased to present some of our activities since our Congress in Abu Dhabi in September 2019 towards our mission to support health for all by enabling the advancement of pharmaceutical practice, science and education. These activities have been conducted in partnership and engagement with our member organisations and as one FIP. The World Health Organization Global Strategy for Human Resources for Health, Workforce 2030, focused on no health without a workforce. FIP puts workforce at the heart of the transformation that is required for our profession to deliver services and innovation to meet the evolving needs of our populations, and we have made much progress in this area. Following the signing of a Memorandum of Understanding with the Indonesian Pharmacist Association while we were in Abu Dhabi, and under the FIP Workforce Transformation Programme, we developed a national framework for advanced practice based on the FIP Global Advanced Development Framework, which is speeding the advancement of practice for the country's 80,000 pharmacists. The framework is applicable to advanced practice across regions and nations and forms part of a workforce reference guide being launched later this month, which will enable and support workforce development and transformation across all our members. The guide is a virtual collection of FIP tools, frameworks and resources that will support our members with workforce development and transformation. We look forward to supporting other countries with this programme, which will be enhanced by the FIP development goals, developed across all constituencies of FIP and supported by the FIP member organisations and council, which represents 108 countries and territories. These development goals incorporate the 13 Pharmaceutical Workforce Development Goals, the PWDGs, for education, developed in 2016, along with new goals for practice and science. This sets out a pathway for the next decade and is an extremely important development for our association, providing comprehensive key resource for transforming our whole profession, uniting us in the vision for one FIP. All this will be further enhanced by the FIP, seal and criteria, which we have piloted with the Australian Pharmacy Council. This creates a clear focus on the essential criteria needed for providers of education, providers of services and practice development to support improvement globally. In addition to this work, we have continued to develop further support for specific groups. One example is the creation of the FIP's Global Academic Leadership Fellows Programme in February, in association with the American Association of Colleges of Pharmacy. This programme will start in 2021, but with AACP, we have also developed an online academic leadership programme entitled Enhancing Your Academic Leadership Horizons in Trying Times. This focuses on navigating COVID-19 as an academic pharmacy leader. The first module of this course will be offered free to all academic leaders around the world on September the 22nd, and the full course will also be open for registration. We have also developed the vision, mission and strategic objectives of FIP's Global Pharmaceutical Observatory. Surveys across all of FIP have been scoped and scheduled, and the data collected will provide benefits by promoting pharmacy and pharmaceutical science, informing policy formation and advocacy activities globally, regionally and nationally. The functional and technical requirements of a survey platform, the database management system and the visualisation platform have been specified, and the technology to support the delivery of the Global Pharmaceutical Observatory have been scoped to meet our needs and the needs of our members. As you all know, since FIP signed up to the Astana Declaration in October 2018, there can be no health for all without primary healthcare, and FIP is proud to be leading the agenda to encourage action from our profession. The strategy to support PHC needs to be enabled across all our regions. And a month after our Abu Dhabi Global Congress last year, FIP and the Turkish Pharmacists Association gathered over 800 colleagues at the FIP Regional Conference for the European region, delivering primary healthcare, pharmacists taking the next leap forward, in Ankara, Turkey. There we embarked on a journey towards healthier populations through stronger primary healthcare with advanced pharmaceutical services applicable to that region. At this conference, pharmacy leaders and pharmacists representing 37 countries signed the Ankara Commitment to Action on Primary Healthcare. This commitment builds on the commitment for primary healthcare that we elicited from the Eastern Mediterranean region earlier in 2019. And although COVID-19 has meant our plans to take actions in the regions of Southeast Asia and Africa have been postponed, we know that our colleagues there are eager to take this work forward and that primary healthcare remains a core focus for us at FIP. Colleagues, the new coronavirus has affected us all in profound ways, and these past few months have required tremendous fortitude from our profession. The WHO declared COVID-19 a pandemic on the 11th of March, but FIP had already sprung into action. In January, just 6 days after the WHO declared the new coronavirus outbreak a public health emergency of international concern, we published international guidance to support our member organisations, as well as pharmacists, pharmaceutical scientists and pharmaceutical educators around the world. The guidance was available in the 6 official UN languages, with further languages added later. As the situation developed and more information emerged, we rapidly adapted our work plans and supported our profession with advocacy and policy tools to facilitate response at country level. And in recognition of its important contribution to easing the huge strain being placed on health systems around the world. This is so crucial. After a broad consultation with our member organisations and constituencies, FIP issued call to action to support pharmacists and pharmacy workers on the COVID-19 front line. This call to action listed 23 urgent measures that governments and other stakeholders must put in place in order to ensure the continuity of pharmaceutical care around the world, so that pharmacists can play an even greater part in the fight against COVID-19. We also worked with the other health professions under the World Health Professions Alliance, issuing an open letter to the G20 heads of states and governments, calling on immediate action to secure personnel protective equipment for health personnel, all health personnel. Guided by the principles of international solidarity, our activities around COVID-19 have been many. Today we simply don't have time to mention them all, but they do include several position and holding statements on important issues such as the association between the use of non-steroidal anti-inflammatory medicines, ACE inhibitors, ARBs and corticosteroids, and an increased risk of coronavirus COVID-19 infection or disease. Testing strategies, hydroxychloroquine and chloroquine as COVID-19 treatments or not, and the evidence base around the use of masks and face coverings. A statement of principle on the impact of the pandemic on health equity and vulnerable patients and populations. A programme of digital events related to COVID-19, responding to the pandemic together. Prevention of vaccination and sustainability webinars and digital programmes. We have run over 40 webinars to date with more than 10,000 people taking part. We've developed a repository of COVID-19 related resources with and by our FIP member organisations, other health or pharmacy related organisations and partners, alongside articles and tools to support you all. An online platform for pharmacists to discuss and exchange inquiries, experiences and initiatives which over 30,000 colleagues are part of. The hashtag Pharmacy Heroes campaign, publicising the incredible efforts of pharmacists who, despite the risks, have continued to ensure access to healthcare for their communities. A weekly newsletter keeping members up to date with FIP's response to the pandemic and news of our programmes and work streams. Many lessons have been learnt during this challenging time, and we have prepared for the future by setting up the FIP COVID-19 Global Expert Advisory Group to support us to increase FIP's capability and capacity in responding to new and emerging needs, both of the workforce and for us to be able to move from urgent rapid response to longer term advice and expertise in selected areas. Now, colleagues, although COVID-19 has taken centre stage this year, we have not ceased to work on our global health priority areas, such as non-communicable diseases. We organised a series of digital events on the role of pharmacists in cardiovascular disease, diabetes, cancer, asthma and COPD. We have been advocating for a stronger role for pharmacists in respiratory care and in preventing the impact of air pollution. The WHO listed air pollution and climate change as one of the top 10 threats to global health, and we are firmly convinced that pharmacists can play an important role in raising awareness about this impact and in supporting our communities, in raising awareness, in protecting themselves from air pollution, just playing our part. As such, we conducted a survey to assess these roles. We will present our key findings next week. We have been working on resources to support pharmacists in their work, and later this year we will release the first FIP publication on vector-borne diseases, as well as toolkits on medicines use reviews and medicines reconciliation services, vital toolkits for our members. Investing in disease prevention is also imperative to global health, and vaccination is a crucial part of this. Our work has included a series of online events between July this year and will continue till January 2021. This programme is called Increasing Vaccination Coverage Through Pharmacists, some of which are taking place in the coming days, and I urge you all to listen, to watch and to take part. This work has been supplemented with our report Give It a Shot, Expanding Immunisation Coverage Through Pharmacists, compiling evidence and best practices from around the world, and a report from a global survey we conducted earlier this year about the roles of pharmacists in vaccination. In addition, FIP is launching Transforming Vaccination Globally and Regionally, a new 3-series digital programme about transforming the vaccination agenda for pharmacy. This is the first FIP transformation outcome-based online programme of its kind, and it will be underpinned by the FIP development goals that are being launched on the 21st of September. The 12-week programme is phased over 3 series, and each series consists of 8 events delivered between the 25th of September, World Pharmacist Day, and the 17th of December 2020. The final outcome of the programme will be the signing of a historic global FIP commitment to action on the vaccination in pharmacy. A special report, the FIP Transformation Collection on vaccination, will be produced to summarise the outcomes of the programme and will be available early 2021. Finally, I would like to mention our work on equity. This year we launched our FIPWISE campaign to help achieve gender equity for women in pharmaceutical science and education, to empower them to achieve their full potential and to attract younger women into the fields of science or education. But as the COVID-19 pandemic has highlighted, equity is broader than focusing solely on gender. Our Equity RX work is highlighting the need to tackle inequality in our societies in terms of access to care and equality of standards of care. And we are working on the global FIP commitment to equity and equality. This will serve as a roadmap for committed and concerted actions promoting equity, equality, diversity in pharmacy and the pharmaceutical sciences to the benefit of patients and our public. FIP colleagues and friends, this has been a year of huge upheaval for all of us. We have all had to change many plans and adapt our ways of working. And at FIP, we also have had to take some difficult decisions. We have had to dig deep, be more innovative and energetic than ever before. But please rest assured that exactly as those of you on the front line are supporting and to continue to be available for your communities, FIP is seeking to emulate this. We are supporting the profession. We continue to be there for our profession. As one FIP, we have many more exciting and valuable developments ahead, and I look forward to sharing them with you in the coming months. And I look forward to being with all of you in Seville 2021. Thank you, colleagues. One FIP.
Colleagues, the COVID-19 pandemic has caused disruption for all of us around the world, and sadly, many deaths, including within our profession. This year has also seen the passing of 3 special members of the FIP family, Olivier Bugnon, Volker van Meel, and Tom Sam. As the global leader of our profession, FIP would like to pay tribute to all these colleagues. Olivier Bugnon from Switzerland was a visionary of pharmacy. As a great professor, scientist, researcher, and pharmacist, he combined competency with humanity, availability, and utmost devotion, and he inspired, motivated, and influenced generations of young pharmacists at the national and international level. With his team, he developed and implemented innovative pharmaceutical services, increasing patient safety and the efficiency of coordinated and personalized care. Olivier set an example as a pharmacist and as a human being. He was very involved in FIP and gave our profession keys to the future. His death is a big loss for all of us. Dutch pharmacist Foppe van Meel led the way in Europe in the implementation of pharmaceutical care practice and research, and was one of the founding members of Pharmaceutical Care Network Europe. A big advocate for the potential of pharmacy, his desire to promote pharmaceutical care led him to join the Continuing Education Program Committee of FIP's Community Pharmacy section, to which he contributed for almost a decade. Foppe was also closely involved with FIP's Good Pharmacy Practice work. Today, we remember these inspirational pharmacists. Tom Sam from the Netherlands was an individual member of FIP since 1999 and served as secretary and president of our industrial pharmacy section. Tom also played an active role on FIP's Board of Pharmaceutical Practice, and he was awarded an FIP fellowship in 2006. We acknowledge his many contributions to FIP and our profession. We would also like to recognize the following members of pharmacy teams who continued to provide pharmaceutical care to their communities during this COVID-19 pandemic and who have lost their lives in doing so. Adriana Alia Gomez, Camilo Alinovi, Oscar Alvarez Rodriguez, Teresa Baca Cruces, Reana Casalini, Florentina Cimiano Valera, Raffaele Corbellini, Maria del Carmen Cuadrado, Sin Boins, Paolo D'Ambroghi, Francesco De Dono, Santiago Diez Garcia, Ismael Drudmus, Patrizio Forti Paolini, Amparo Gadea, Pedro Garcia, Isan Guire, Mahmoud Goga, Julio Gutierrez Montalvo, Ibrahim Kara, Himet Tassan Cadaslar, Peter Machet, Fernando Marcantonio, Fermín Martínez, Abdelilames Fioui, José Tomás Mijimol, Helen Milleham, Ismail Mahomedi, Faziel Mozaji, Farouk Osman, Ekrem Özdemir, Shashikant Parek, Yaesh Banubai Patel, Mehul Patel, Ilario Pelin, Antonio Perani, Nieves Kiralte Abello, Paul Ras, Birenda Karavat, Michel Ranson, Lorenzo Repetto, Daniel Arrigoni, Manuel Ruiz, Francisco Javier Santamaria Blanco, Yves Manuel Segui, Navin Shantial Talati, Pooja Sharma, Mandi Sidon, Sureya Sipkinkurt, Ying Song, Antonio Tilly, Mary Yalcinos, German Wright. This is not an exhaustive list. We know there are many more who we are not able to name. We extend our condolences to their families and friends of all these departed colleagues, and let us now observe a moment of silence as we remember and pay our respects to them. Now, colleagues, it is time for a happier section of our opening ceremony, the FIP Awards. I will be announcing the awards to individual pharmacists before handing over to the FIP Professional Secretary, who will be revealing the awards to organizations. This year, we have two big awards to individuals. FIP's André Beda Award and a new award, the Kamal Mida Award for Exceptional Leadership. The André Beda Award is FIP's highest pharmaceutical practice award and is awarded every 2 years. Professor Martin Schulz is its latest recipient. This award is made to Martin in recognition of his distinguished scientific and academic record and contribution to pharmacy practice and clinical pharmacy. His long career includes roles as head of the Federal Union of German Association of Pharmacists, ABDA, Center for Drug Information and Pharmacy Practice, Director of ABDA's Department of Medicine, Director of Pharmacy at the German Institute for Drug Use Evaluation, Adjunct Professor at the Institute of Pharmacy, Free University of Berlin, and Chairman of the Drug Commission of German Pharmacists. Martin has had a strong influence on European pharmacy. In the 90s, he was one of a few individual innovators who drove the concept of pharmaceutical care in Europe, which in turn influenced its development in FIP and internationally. Subsequently, he co-founded the Pharmaceutical Care Network Europe. His European leadership has significantly changed the way in which research is conducted and the way the profession has moved to patient care in Europe. I encourage you to log in for his André Beda Award lecture entitled Pharmacist-Led Interventions to Improve Outcomes of Patients with Cardiovascular Diseases tomorrow during the plenary session. But I would like us to hear a few words from Martin now.
Mr. President Dominique Jourdan and Paul Sinclair, Chairman of the Board of Pharmaceutical Practice, dear colleagues, thank you for your kind words, and I would like to thank your respective council and board for granting this award. It is a great pleasure and honor to be recognized by such a prestigious award. Although the award has been presented to me, I see it as a recognition to the many colleagues that for the past 30 years have had and continue to have the passion, dedication, and enthusiasm to undertake research, education, and negotiation in order to ensure the future of pharmacy. Most governments, patients, and other members of the healthcare team, including physicians, have shown a positive predisposition to accept and work with pharmacists who are providing cognitive pharmaceutical services and broadening the scope of practice for the welfare of our patients and the benefit of our healthcare systems. The imminent challenge for the profession lies in applying research findings to sophisticated and practical programs that can assist pharmacists adapt their professional practices and businesses to sustainably implement pharmaceutical services. I've been fortunate enough to work at an international level, facilitated mainly through the community pharmacy section of FIP. And I thank successive presidents and board members of FIP and the CPS, respectively. There have also been wonderful research groups who have directly contributed to develop pharmacy practice and pharmaceutical care, and with whom I have had the pleasure and honor to collaborate. These groups have been under the leadership of Professor Doug Hepler from the United States of America, Professor Charlie Benrimoy from Australia, Professor James McElney from the UK, Northern Ireland, and Hanne Herborg and Bente Frøkjær from Denmark, whom I have worked with on the CPS program since FIP Tokyo 1993. I also thank my colleagues in the BPP and the FIP Program Committee for many years of work and fun Thank you, Professor Henry Menassi and Professor Phil Schneider. In addition, there has also been too many to mention individually, other academics and international representatives who have taught me more than I'm able to quantify. In short, but from my heart, thank you, Eva, Tom, Tommy, Reich, Darryl, Lotte, Victoria, Charlotte, Fernando, Miguel, John, Maria, Claire, Martin, Albie, Kurt, Jonathan, Bert, Marcel, and Ross, standing for my colleagues all over the world. With all these individuals, I share this award. And I also share this award with the following colleagues and friends who left us much too early. Dr. Dick Tram from the Netherlands, Professor Peter Noyes from the UK, and most recently, Professor Olivier Bugno from Switzerland and Dr. Forbert van Mil from the Netherlands. Throughout my career, I have also received enormous support and mentoring from my professional colleagues. Individuals like Friedemann Schmidt, president of APTA, have been in the forefront of continuous source of financial, organizational, and political support, even when the issues being highlighted were considered controversial yet self-evident, and the headwind became stronger and stronger. I would like to further thank my teams at APTA headquarters in Germany. You are academic professionals, and although based outside the university, your research was and is outstanding. Finally, let's recall what you say first and last will be remembered. I thank Ulrike for providing enduring and enthusiastic support. You are my life partner and best friend. Thank you.
The Kamal K. Mida Award for Exceptional Leadership is a new award to FIP. It is named after FIP past President Professor Mida, who led our federation through its previous strategic plan and was a great statesperson for our profession. Kamal has had an illustrious career as an academic and prominent pharmaceutical scientist. I will now read a message from Kamal Mida according to his request. Dear Mr. President, friends and colleagues, I am honored and thrilled that FIP has established an award in my name, and especially because the Mida Award will recognize exceptional leadership on behalf of and in service to FIP. It is through dedicated leadership that FIP will reach its full potential to enable equitable and quality pharmaceutical care to all patients around the world. Thank you, and my best wishes to my friends and colleagues within FIP. Kamal K. Mida, Honorary President of FIP, Immediate Past President 2010-2014, President of FIP 2006-2010. I am pleased to name as the recipient of the inaugural Kamal K. Mida Award, Professor Bill Charman. Bill Charman is a distinguished pharmaceutical scientist and has been an international leader dedicated to the advancement of the pharmacy profession for almost 2 decades. Within the pharmaceutical sciences, he successfully implemented a multidisciplinary and collaborative approach to develop innovative solutions in drug discovery and drug delivery research, especially for neglected diseases such as malaria, and has advised the World Health Organization and the Wellcome Trust, among others. As Dean of the Faculty of Pharmacy and Pharmaceutical Sciences at Monash University, Bill led curricular transformations to elevate education and training. This award recognizes Bill's leadership in building on educational leadership across FIP to establish FIP education as a formal structure. Bill contributed to the success of the Global Conference on Pharmacy and Pharmaceutical Sciences Education in Nanjing and a deepened engagement with the Chinese Pharmaceutical Association and the American Association of Colleges of Pharmacy that continues to bear fruit for FIP today. Now I give the floor to Bill for a few words.
Dr. Meader has been my mentor and guiding light during much of my professional career. He taught me to have an ambitious vision and of the value of generosity, humility, and of service to our profession. It is for these reasons that I'm thrilled to be the inaugural recipient of the Kamal Meader Leadership Award. Now, of course, I'm only here because of the talented people I've worked with. I would like to thank Ian Bates, John Pieper, Ralph Altieri and Wayne Hindmarsh, who are the leaders of the education programs at FIP. I'm grateful to Carmen Pena, Dominic Jordan, Catherine Duggan, Emma Polino and Giovanni Poletti for their guidance and support over the last 5 years. And lastly, a special thank you to the team at Monash and especially Marion Costello as they encouraged and enabled me to undertake my work at FIP.
FIP Fellowship recognizes individual members of FIP who have exhibited strong leadership internationally, distinguished themselves in the pharmaceutical sciences and or practice of pharmacy, contributed to the advancement of pharmaceutical sciences and or practice or pharmacy, and who have served FIP. FIP Fellows may use the designation FFIP. This year, I have pleasure in announcing 8 new Fellows. Mr. Jaime Acosta Gomez, Spain. Jaime Acosta Gomez has served FIP passionately since he became a member. He has given valuable support to our community pharmacy section, particularly contributing to a global communication platform within the section, working on a long-term plan for developing 16 webinars that have reached more than 18,000 colleagues from 150 countries, chairing 8 innovative sessions at 5 FIP congresses, and leading the community pharmacy section social media and communication. His work has allowed the section to reach more than 25,000 pharmacists globally. Jaime translated the CPS vision, making it available for many Spanish-speaking colleagues worldwide, but his work has not been limited to the section. He is a member of the FIP Technology Forum, as well as member of the FIP Board of Pharmaceutical Sciences Social Media Steering Committee. In his home country of Spain, Jaime negotiated with external stakeholders when developing an electronic prescribing tool in Madrid, helping to achieve smooth implementation in all pharmacies and ensuring that the tool not only has administrative function, but also advances pharmacy practice. Dr. Jill E. Martin Boone, USA. For over 10 years, Jill Boone has used her leadership skills to serve FIP in the areas of education and workforce development, and has been an integral part of the FIP education mission. Her contributions to FIP include delivering global reports and leading developments in the field of interprofessional education. She has generated innovation, progression, actions, and revenues in this important area of education and practice development. For example, the World Health Organization has acknowledged the importance of interprofessional education as a foundation for better pharmaceutical health delivery, collective working with pharmacists, and overall workforce development. Jill has also contributed significantly to education and workforce development actions within FIP education, including the successes of the historic Global Conference on Pharmacy and Pharmaceutical Sciences Education in Nanjing, China, and the Workforce Development Goal on working with others. Professor William N. Charman, Australia. I have already described to you many of Bill Chairman's leadership achievements as the recipient of the first Kamal K. Meader Award. This year, Bill completed a 5-year term as chair of FIP Education, during which he facilitated the creation of the academic pharmacy section, academic institutional membership, and the workforce development hub into a highly productive structure that had enhanced the visibility of FIP among key stakeholders. With this fellowship, we recognize his service to FIP, particularly his contribution to strengthening FIP education. Dr. Martin Enman, Ireland. Martin Enman has contributed to many international bodies as a leader, researcher, representative and an expert in medicine's use, health policy, education and lifelong learning. He has helped transform education in pharmacy, medicine and dentistry through European Union funded projects. In particular, Martin has advanced the area of pharmaceutical care. In addition to chairing Pharmaceutical Care Network Europe and serving on its committees, Martin is a consultant for the European Directorate for the Quality and Safety of Medicines and Pharmaceutical Care. He has contributed to its report on pharmaceutical care and pharmaceutical care indicators. Recently, he was lead author of a resolution of pharmaceutical care for the member states of the Council of Europe. Martin's research has added to our knowledge of pharmaceutical care, health policy, pharmacy services, pharmacy education, and competency development, and the use of medicines in vulnerable populations. He also serves as Director of Global Relations at his School of Pharmacy. He has contributed to a number of FIP groups and was a member of the host committee for the FIP Congress in Dublin in 2013. Professor Marilyn Morris, USA. Marilyn Morris is an internationally recognized scholar for her research on membrane transport proteins, their influence on the pharmacokinetics and pharmacodynamics of drugs, and their use as therapeutic targets. Among her numerous seminal contributions are her work on the characterization of biological drug transporters and her groundbreaking research on the role of dietary flavonoids in disease prevention and drug interaction and resistance, which has enormous implications for cancer treatment and future cancer research. Marilyn started her career as a clinical pharmacist before moving into pharmacy education. She has taught pharmacy and graduate students at the University of Buffalo for more than 34 years. She has held numerous leadership positions, including as president of the AAPS, and has received many awards. Currently, Marilyn is standing member of the U.S. National Institutes of Health's XNDE study section, and previously served on the U.S. Food and Drug Administration Clinical Pharmacology and Pharmaceutical Sciences Advisory Board and the U.S. Environmental Protection Agency Scientific Chemical Advisory Board. She has exhibited strong leadership internationally and contributes to FIP through the Executive Committee of the Board of Pharmaceutical Sciences. Dr. Charlotte Rossing, Denmark. Charlotte Rossing has shown international leadership in the fields of pharmaceutical care and continuous professional development. She has served as a board member of Pharmaceutical Care Network Europe and has represented Europharm Forum at the European Directorate for the Quality of Medicines to develop pharmaceutical care indicators. Charlotte has worked to advance and evaluate community pharmacy services in Denmark and internationally since 1999. In her capacity as Director of Research and Continuous Professional Development in Pharmacy Practice, she promotes the development of pharmacy and supports capacity building among Danish pharmacists and pharmacy technicians. She is a founding member of the Danish Network for Community Pharmacy Practice Research and Development. She strongly supports international perspectives to Danish pharmacy practice and hosts several webinars to support Danish participation at FIP conferences. Charlotte was part of the founding group of FIP's Special Interest Group on Pharmacy Practice Research and is currently its Vice Chair. She has been involved in many FIP programs, including its Forum for Innovators, Technology Forum, and our initiatives FIP WISE, which endorses equal opportunity for young female and minority pharmacist researchers. Mr. Vayapuri Subramaniam, USA. Puri Subramaniam has been member of FIP for 25 years and currently serves as treasurer of the Social Administrative Pharmacy section. He was a community pharmacist and a hospital pharmacist before moving to the US Food and Drug Administration, where he developed regulatory standards to improve oversight of compounding practices and was the principal author of the first published research from the FDA on the quality of compounded drugs from US pharmacies. Later, at the US Department of Veterans Affairs, Puri was the architect of its first integrated web-based adverse drug event reporting system and developed the first national policy to monitor compounding steroid products and hazardous drugs. It was there that he also led cultural and diversity programs promoting pharmacists' clinical roles and scope of practice to address health literacy and medicine adherence as components of care to Asian Americans and Pacific Islanders. Puri regularly shares his knowledge at FIP congresses and on American Pharmacists Association expert panels. He led the development of the American Society of Health System Pharmacists Statement of Policy on Public Health and contributed to FIP's report on the role of pharmacists in the health supply chain. Professor Shigeo Yamamura, Japan. Shigeo Yamamura has made 12 years of selfless contributions to the FIP education mission. Since 2008, when he was invited to be an advisor for the Pharmacy Education Task Force, he has been an integral part of FIP's education and workforce development work, particularly in the developing field of workforce intelligence and data analysis. Shigeo has been instrumental in the initiating, planning, and design of the first global observatory for the pharmacy workforce, now represented within FIP as the Global Pharmaceutical Observatory. He has consistently contributed to the unique thinking and analysis of the FIP data collection, workforce database, and the workforce intelligence strategy of the observatory. The originality of the Global Pharmaceutical Observatory impacts on FIP's ability to be global leader in workforce intelligence. Shigeo now serves on Observatory's advisory board, providing consistent expert advice and support for this development program of work in FIP. He also made major contributions to the successes of FIP's Nanjing conference with his valuable and necessary input into the Nanjing outcomes, including the workforce development goals. These contributions, among others, make Shigeo well deserving of this FIP fellowship. My congratulations to you all on these well-deserved awards, and thank you for the work that you have done for our profession.
Greetings, dear colleagues around the globe. My name is Emma Paulino and I'm the Professional Secretary of FIP. It is an amazing feeling to be addressing you from Portugal today, virtually, on behalf of the FIP headquarters in the Netherlands. It is my honor and privilege to announce the Member Organization Awards. Without further ado, I will proceed with the announcement of the nominees and award winners. The first award is the Health Promotion Award. This award recognizes a health promotion campaign developed and run by an FIP member organization or one of its chapters, and it is presented every year. Nominees for the Best Health Promotion Award Campaign 2020 are Research and Practice on the Cultivation System of Pharmacist Talents for Higher Pharmaceutical Education in Serving Health China, from the Chinese Pharmaceutical Association, China. Antibiotic Resistance Awareness Campaign from the Pharmaceutical Society of Nigeria, YPG-PSN, Nigeria. Mental Health Awareness Campaign from the Pharmaceutical Society of Nigeria, YPG-PSN, Nigeria. Pharmacy Profession Awareness Campaign and Substance Abuse Campaign from the Pharmaceutical Society of Nigeria, YPG-PSN, Nigeria. Revista Saúde, Associação Nacional das Farmácias, INF, from Portugal. Éxito, Niños, Jóvenes y Farmacia Comunitaria, Éxito, Children, Adolescents and Community Pharmacy from the General Pharmaceutical Council of Spain, from Spain. And this year's winner is the Pharmaceutical Society of Nigeria, YPG-PSN, with Mental Health Awareness Campaign. Let's hear what they have to say about this amazing campaign.
The aim of the campaign was to provide accurate information and correct wrong perception of the public about mental health conditions. In order to achieve maximum impact, stakeholders in the community were engaged from the planning to the execution of the project. On the day, volunteers who are young pharmacists and who had been trained and certified on the roles of pharmacists in management of mental health conditions were provided with a brief that was repeated in these 5 languages spoken in the area: English, Yoruba, Igbo, Hausa, and Pidgin. At the end of the day, 1,250 people were reached, and over 180 people were referred to our partner organizations using the flyers for monitoring and follow-up. Overall, the aim of the campaign was achieved, and we were able to accentuate the role of pharmacists in the community.
The next award is the Pharmacy Practice Improvement Award. This award recognizes a program developed and run by a member organization of FIP or one of its chapters during the previous year, aiming to improve or expand pharmacy practice with some innovative vision on the pharmacist's role. Again, this award is presented every year. Nominees for the Best Pharmacy Practice Improvement Award campaign are SHPA Residency Program from the Society of Hospital Pharmacists of Australia, National Quality Improvement Program on Compounded Medicines from APB, Belgium, Awareness Campaign Medicine Information website www.apotheek.nl from KNMP, the Netherlands, João Cordeiro Award, Innovation in Pharmacy from the Associação Nacional das Farmácias from Portugal, Adherencia Med, Adherence Management Service from the General Pharmaceutical Council of Spain, Pharmaceutical Care Forum in Community Pharmacy, Foro IFFC, Practical Guide from the General Pharmaceutical Council of Spain, My Care Start from PharmaSwiss, Switzerland, a competency framework for designated prescribing practitioners from the Royal Pharmaceutical Society, RPS, UK, and the ASHP Practice Advancement Initiative from ASHP, USA. This year's first winner is APB Belgium with National Quality Improvement Program on Compounded Medicines. I want to congratulate them and give them a minute to tell us about their program.
Pharmacy compounding is preparing personalized medicine in the exact strength and dosage required for a particular patient. It might seem something from the past with all these branded and generic medicines available. Still, all 4,800 Belgian community pharmacies compound medicines within the pharmacy, close to the individual patient. Pharmacists use state-of-the-art equipment, follow protocols, making every preparation step traceable. In 2017, the Association of Pharmacists in Belgium, APB, started a national quality improvement program on compounded medicines, where pharmacists can send samples of prepared medication to the APB. Upon reception, these medicines are checked for packaging, labeling, and analytical testing. APB's Medicines Control Laboratory has the qualified infrastructure, staff, and expertise to do all relevant quality control tests on these compounded medicines. Next is the individual and confidential feedback every pharmacist receives on the quality of his preparation. And lastly, anonymized and global results are made available through professional press and websites. Our National Quality Improvement Program on compounded medicines is completely free of charge and helps Belgian pharmacists preparing and dispensing compounded medicines of indisputable quality.
And the second award for pharmacy practice improvement goes to the General Pharmaceutical Council of Spain with their Adherencia Med, Adherence Management Service. Let's hear what they have to say about this amazing program.
Dear FIP colleagues, we are deeply honored and we would like to thank FIP for this award to Adherencia Med, a project led by the General Pharmaceutical Council of Spain in collaboration with the University of Granada, the University of Technology Sydney, and funded by CINFA Laboratory. Adherencia Med is a research program conducted in community pharmacies from 6 provincial pharmacy chambers. The main goal was to assess the clinical, economic, and humanistic impact of a community pharmacy-led adherence service in patients with high blood pressure, asthma, or COPD. Pharmacies made very complex interventions on more than 1,000 patients using a combination of evidence-based models for behavioral change, as well as other strategies such as pharmaceutical advice, monitor dosage systems, and education on inhalation technique. Data was recorded in our IT platform called NodoPharma. During the program, we rely on a practicing facilitator, pharmacy who provide help to community pharmacies to make the change needed to implement the service into daily routine. The results have shown a 30% decrease of adherence and a significant increase in the percentage of patients with current inhalation technique. There was also a positive impact in the clinical control of the diseases and almost 5% improvement in the patient perceived quality of life. Last but not least, the service was achieved to be cost effective and 75% of the pharmacies were able to implement it in their daily practice.
I would like to finish by thanking and acknowledging the great work done by member organizations throughout the year. It is getting more and more difficult to choose the winners of the FIP annual awards amongst so many great initiatives. Those who benefit the most are obviously our patients and society as a whole. It is truly an honor to be a pharmacist at such complex times. Let's now proceed with the celebrations.
Dear colleagues, it is an honor to participate in the opening ceremony of FIP Virtual 2020. This is a virtual congress in which we will address the lessons of the pharmacy in this unprecedented global emergency. A pandemic that is proving the importance of global and local action in which pharmacists in all countries are developing such a vital work. The COVID-19 health crisis has forced us to take the decision to reschedule the 80th FIP World Congress of Pharmacy and Pharmaceutical Sciences and 22nd National Pharmaceutical Congress of Spain until 2021. I would like to express, as head of the Spanish pharmacist, that it's a great privilege and a great honor that my country has the confidence of FIP for this great global event to be held in Sevilla. We are really confident that it will be a magnificent meeting giving the morning, the technological revolution impact of pharmacy and healthcare. We will show the value of the pharmacy for health systems in the global context of digital revolution after this situation and in this complex health moment. Sevilla will captivate you with its charm and beauty, and it will be impress you with its
distinctive historical and artistic heritage, a cultural experience that together with its wonderful climate and its extraordinary gastronomy and the art of flamenco, will complete what will be a great congress. We at the Spanish delegation look forward to sharing great moments with all of you in Sevilla. I encourage you not to miss the opportunity to be the start of FIP Congress 2021, to be the stars of the pharmacy of the future. Together, we will continue adding knowledge and experience, leading the progress of the pharmacy in the world. Thank you very much, and see you in Sevilla 2021.
Dear colleagues, the past 7 months have underlined the huge importance of collaboration across borders, the importance of sharing knowledge, and the importance of being united. That is why FIP has created FIP Virtual 2020 to bring people together, even if it is virtually instead of physically. We cannot ignore our current situation, hence the title of our main program, Living and Learning Through COVID-19 Pandemic Global Reflections. However, we cannot forget our ongoing commitments and mission, and we must not allow work on important issues for our profession and our communities to be delayed. During this pandemic, we have witnessed the efforts of pharmacy teams on the front line. We have also seen tremendous work in pharmaceutical sciences to deliver COVID-19 treatments and vaccines, and in pharmacy education to continue to teach and train our undergraduates and to ensure a sufficient workforce. We all have much to be proud of, and to reflect this, FIP is dedicating 1 week of FIP Virtual from 21st September to celebrate pharmacy. This week will showcase the work of our profession around the world and will include several key events, including the launch of FIP development goal for the whole profession, the release of updated versions of our Global Advanced Development Framework and FIP Global Competency Frameworks, the start of the first module of our Global Academic Leadership Fellows Program, FIP was initiative event for women in pharmaceutical science or education, the launch of our FIP Commission on Antimicrobial Resistance, the beginning of transforming vaccination globally and regionally, a new 3-part digital program from FIP. This World Pharmacy Week will conclude on Friday 25th September with our 10th World Pharmacist Day. FIP has created an app for you all to record and share your own messages on how you are transforming health. I encourage you to use this app to amplify the value of our profession to the world. FIP is supporting the pharmacy profession and will continue to be there for the profession. Acting together as one FIP and working with trust, solidarity and actions will help us achieve our vision of a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies, as well as from pharmaceutical care. I truly hope that all our events over the next 2 weeks give you opportunities to join your peers in a highly interesting and engaging program, and it is now my privilege to declare FIP Virtual 2020 open. Long live pharmacy, long live FIP.